Good morning, Patrick here from Complete Health. And I have a question. I like questions. Why now is our clinic probably getting more acquisitions than we've ever had ever? Why is our clinic getting more acquisitions? Why have we got more people coming in now than ever before? Now, let me just make this explicitly clear. We're doing everything we possibly can to try and keep everyone in the clinic safe. We've obviously got screens, etc., up in the front desk. We do obviously ask that people wear masks. We've opened up and spaced out our front desk so that things are all separated. But despite the fact that we're in the middle of a pandemic, why is our clinic so busy now than ever before? And interestingly enough, when I observe what's going on in the environment right now, or what has been going on for the last 9 months, and some of the statistics that have been thrown at me, obviously I'm getting statistics thrown at me all the time. But interestingly enough, stuff like alcohol consumption has gone through the roof. Places like Domino's Pizza and Tesco's are hitting the absolute peak of their careers or their existence, where people are spending so much money with those companies. And the main reason being is that people are binging more, they are stress eating, they are lacking in exercise, they're not sleeping properly, they're using drugs and alcohol in order to actually improve their mood. And here's the question: what is health? Because when we use that word health, or am I healthy, or how do I become healthy, we have to understand really what the definition of that truly means. Because when we look at the definition of health, and this is set out by the World Health Organization, who are the same people that are currently writing guidelines for everything going on now, and they define complete health like this, which is the complete physical, mental, and social well-being, and not merely the absence of disease. Complete physical, mental, and social well-being, and not merely the absence of disease. And I will be repeating this sentence until I die, because at the moment we are not demonstrating almost any of the above. Why? Because people are moving less, they're eating more, they're drinking more, they're more stressed, they're socially distanced from absolutely everyone in their life, including their family and their friends. Interaction has gone down. People are making makeshift desks at home. People are literally scraping together the pennies to try and make their rent if they own a business. And this has possibly been one of the hardest times, where we have so many resources available to us. We have the internet, we have telecommunications, we have pretty much anything you could possibly have to be able to make things work, yet people are being put in a position where they physically cannot make their life work. However, there are still things that we can do that can actually help us improve on our health. And this is one of the reasons why we have probably the biggest acquisitions, and one of the reasons why I'm seeing huge numbers in people relapsing in their care, because their stress has gone up, and therefore we're causing toxicity in our bodies through stress, physical changes, and the chemical changes from the lifestyle habits that we are starting to take place. Eating more food with sugar and salt is going to cause a toxicity and chemical change in our body. Alcohol is going to cause a toxicity and chemical change in our body. Stress, it increases cortisol, it increases adrenaline. It causes a toxic effect in our body. And when our body becomes toxic, it develops symptoms. Simple. It's simple. You don't need 150 journals to tell you, if you ate only sugar for the rest of your life, that you will probably develop diabetes. We don't need research papers to tell us that. All you have to do is look at someone that leads a lifestyle that eats a load of sugar and a load of fat, and the likelihood is the more weight they put on, the more likely their insulin levels are going to become less or insufficient for what their body needs. So look at what's going on around you. Maybe start to identify some of the toxicities in your life, whether that's a lack of physicality, whether that's a lack of adequate food in your diet, or whether that's a lack of social interaction or looking after your mental health. And again, the point of this page is for people to come and ask us questions and lead, so that we can lead you to the ideal states of health. That's the point. Look at the name, Complete Health. We want you guys to understand how you actually reach those points. Patrick here from Complete Health. Sorry to go on a massive rant. It's killing me to watch so many people slowly kill themselves. And ironically, someone has we say this a lot, is that, if someone was about to jump off a cliff, you would try and stop them. However, when you watch someone consistently drinking themselves into stupidity, or consistently eating themselves into stupidity, we never actually say anything about them, but essentially that person is committing suicide slowly. Patrick here from Complete Health. I hope you have an absolutely amazing day. If you guys need any tips on how you can actually improve your health, please get in touch. This has probably been one of the hardest times for people to look after their health. If you need some advice, maybe you need some inspiration on how you can do things as far as exercise routines and stuff are concerned at home. Again, point of the channel, send us a private message, send us a message, leave us a comment, and we'll try and get back to you ASAP. Patrick here from Complete Health, and I will see you tomorrow.